Greetings and welcome to another lecture in Introductory Psychology. This one, not surprisingly, involves health psychology. Now, health psychology is a booming field these days. It's one of the few fields in psychology that is actually expanding its numbers of practitioners instead of contracting. And part of the reason is that we're running more and more into problems that could hopefully be fixed by health psychology. Because what health psychology does is it uses psychology to help keep us healthy. We all know that there are behaviors that we should be doing, and perhaps we're doing them. We are told this by doctors. We are told this by psychologists. Sometimes it's common sense that we should eat properly and get enough sleep and get enough exercise and minimize stress and go to the doctor when we're sick and all sorts of other things. The problem is a whole lot of people aren't necessarily doing that. And this is beginning to have an effect. Now, here in the United States, for the most part, people are not dying of the same causes, the same things that killed us historically as a species. Here in the U.S., we've solved a lot of the problems that used to shorten people's lifespans. Even as short as 100, 150 years ago here in the United States, the average life expectancy for a male was only probably in the 50s, and maybe for females about that, if not less. For females, it's interesting. If a woman lived through her childbearing years, she could wind up living an awfully long time. But a lot of women died in childbirth. Not necessarily because childbirth killed them, but particularly in the late 1800s, women would die in childbirth because of infections that would be passed from doctor to patient. Because doctors weren't really aware that you needed to wash your hands in between patients, for instance. The idea of antiseptics, the idea that came along with Louis Pasteur and the rest hadn't really caught on here. So a lot of women would die of what was called childbed fever, which was just an infection that they would catch after they give birth in the hospital. At any rate, we don't have to worry about that now here in the U.S. Nowadays, of course, our life expectancy is upwards in the 70s or even the 80s. But what's killing us these days is not what historically killed us then. What killed us then tended to be things like infections, things like illnesses, things like accidents. And we've learned how to either fix or prevent a whole lot of those in this country. Now, not everywhere. For instance, here in the U.S., we have very little malaria. But in other parts of the world, such as Africa and Southern Asia, there's lots of malaria. And that could be a real problem. People are dying by the thousands from malaria. But not here, because we've managed to prevent it by getting rid of the mosquitoes that carry the parasite. We could also treat malaria and give people medications to prevent it if they're exposed. We can do that with lots of things now. Antibiotics, vaccines. We can prevent these things or fix them. So what is killing us now is a whole new batch of diseases. We're not all living until we wear out at the age of 100 and whatever. It's estimated that age is about 120 maximum. And there are people that have gotten darn close. But what's killing us now are called lifestyle diseases. And they're named exactly what they are, lifestyle. Basically, the way we are behaving, or perhaps the way we're not behaving, is causing our lifespan to be shorter than it might otherwise be. These are diseases, these are disorders that, in the words of the great Jimmy Buffett, are our own damn fault. In other words, if we behaved properly, we might be able to minimize these. I give you a list of the leading causes of death in 2004. It's one of the most recent lists that I can find here in 2013, because it takes a while for this stuff to be published. Now, if you look at these, you'll notice that a lot of them have a behavioral component. Now, not all of them are. I am not going to be one of those people that say, well, if you exercise and eat properly and get enough sleep and vaccinated, blah, 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 you'll live forever. Because you won't. Things happen. And we can't prevent everything that happens as much as we might want to try. We can't. But a lot of these things we could. Diseases of the heart, by far, the leading cause of death. Heart attacks caused by a blockage of arteries and veins. Well, there's all sorts of things that go into that we could do. We could eat properly. They're learning more and more, by the way, that high cholesterol and cholesterol problems are not necessarily due to a high cholesterol diet. They seem to be more due to a high sugar diet. Because a high sugar diet leads perhaps to type 2 diabetes, but it also can lead to a lot of insulin, and a lot of insulin can lead to inflammation of the blood vessels, and when blood vessels are inflamed, they attract cholesterol, which sticks to the side of the blood vessels and starts to narrow them and leads people into angina and into heart attacks. Eat properly, exercise. That could take care of a lot of those. Not all of them, but a lot of them. Cancer. A lot of cancer has behavioral components. Ending tobacco use entirely would end a lot of cancer. A lot of cancer. Things like getting screened early for cancer, whether it's mammograms or prostate exams or whatever, getting screened early for cancer can help to sort of nip it in the bud, get it while it's small before it becomes deadly. Stroke. Stroke can be caused by two things. It can be caused by blockage in a artery or vein in a blood vessel, which goes along with the whole cholesterol thing I talked about with the heart, or it can be caused by a bursting of a blood vessel, which might be linked to high blood pressure, which also has a behavioral component. COPD, chronic obstructive pulmonary disease, is a whole grouping of problems with the lungs, problems with breathing, a lot of which have behavioral components to them, or may at least. Emphysema is, in many cases, self-inflicted by smoking. Things like asbestosis, exposure to asbestos particles. If a person is aware of the particles and wears breathing protection, they can hopefully prevent a lot of that. Black lung disease, again, it comes from inhaling coal particles down in mines, hopefully can be fixed by preventative. Accidents. Well, we could be more careful. We could, not do stupid things. We can get treatment for problems as soon as they occur. Diabetes. Type 1 diabetes can be helped behaviorally by making sure that insulin levels are kept as constant as possible through diet and through insulin injections. And type 2 diabetes, of course, can be either treated or prevented by changing diet and exercise. Influenza and pneumonia. Get the vaccinations. They're not perfect, but they not only reduce the likelihood of a person catching in the flu or catching pneumonia, but they have also been shown to reduce the severity of the disease. Alzheimer's disease. Not a lot necessarily we can do about that one, but there is some evidence that keeping the brain active can help stave off the symptoms of Alzheimer's disease, which is why there's all these, keep your brain young programs out there and such like. Kidney disease. Again, this is pretty biological, but people who may have mild kidney disease, for instance, can keep it from getting worse by watching their diet, not eating too much protein, not eating too much sugar, making sure they drink plenty of water, that sort of thing. Systemic infection. Well, if you think that you're getting an infection of some kind, you should go to the doctor and get it treated before it turns into a giant galloping sepsis. Suicide kind of goes without saying. Psychological help can help a lot with that. Liver disease very often is self-caused by alcohol abuse or by overdosing on certain over-the-counter pain medications like Tylenol and Aleve. Those can also eat your liver. And there's a lot of accidental overdosing and liver damage occurring these days from Tylenol and Aleve. Just because something is over-the-counter doesn't mean it's necessarily safe. Read the label. High blood pressure oftentimes has a behavioral component in terms of not only perhaps taking medication to reduce it, but also exercise and watching the diet that can also reduce it. Homicide, well, we're working on that. Like I said, I'm not saying that perfect behavior you can avoid all of these things. I am saying that with good behavior, not perfect, but good behavior, we can reduce the likelihood of getting a lot of these. And between taking care of obesity and taking care of heart disease, that would really reduce the amount of sickness and death that we have in this country and the amount of treatment that people need. And health psychologists spend a lot of time trying to convince people to change their ways. But as I mentioned in Why We Eat, those lectures, that's kind of difficult. Now, some health psychologists study the interaction between, for instance, our mind, our behavior, our consciousness, as well as our body and the body's component, which is the immune system. Well, the mind is as well. The body has both the mind and the immune system, and they all affect one another. And studying how all of these affect one another is technically called Psychoneuroimmunology. Isn't that a $10 word? But if you break it down, it makes perfect sense. Psycho for psyche, which means mind. Neuro, neuron, That's in the brain and the nervous system. Immunology, the immune system. We're seeing more and more how these three things interact. For instance, stress, which is purely psychological, can cause a physiological effect in the body, which then can affect the immune system. And you know, for instance, that if you're not feeling well and your immune system is battling something, that it's going to affect your mind. They go around and around, these three. Now, after having spent about 10 minutes talking about health psychology, I just want to let you know that for the rest of the lectures on this topic, I'm going to be focusing on stress, simply because these lectures and these classes are mostly aimed at people of college age, and people of college age aren't really running into the error of their ways just yet when it comes to behavior. And so, but stress is something that we all run into, and stress can definitely affect your health. So, if you want to learn more about health psychology, if you're at a college, they may well have a class in it. It's really fascinating stuff. And like I mentioned, it's one of the few branches of psychology, along with gerontology, working with the elderly, and also working with children with autism, that really is growing in terms of practitioners, as opposed to shrinking like a lot of the clinical and certainly the experimental psychologies are.